Hey everyone, I'm going to talk about the checklist of prescription writing. So, first, these are the steps that you're gonna follow. The first thing, the student has to enter the room and walks to the chair and then sit. This is like something basic. Greet the patient with a smile and introduce him or herself. Um, Explain the patient that he or she will be given a prescription with the case and write the prescription for the patient. Um, Explain. Okay, just okay. After just you read and write the prescription, explain the patient about the details of prescription in a simple and understandable language. Ask the patient to repeat the details to ensure understanding of the patient. What a doctor, though, because ask the patient to repeat. This is something that most of doctors don't do, so this is something like spectacular once you say to the patient, repeat what I've said to you. So this is good. After this, ask the patient if he or she has any question and then thank the patient. So these are the basics like entering the room, greeting the patient, explaining that you're gonna be giving her a prescription, read the scenario, and then write a prescription for the patient. Explain the prescription for the patient, and ask the patient to repeat what you have said for her or him. Ask the patient if she does have questions, and then thank the patient. Thank you very much for your whatever. Okay, so these are the steps, basic steps that you're gonna do once you prescribe a prescription for your patient. So here prescription components, we have the header or heater, and um, then we have the body, okay, the footer. So the first thing, the heater, the doctor's going to contain doctor's data and patient data, okay. I just it's going to be the name of the doctor, qualification, whether he has a certain certification, degree, or etc. The address, of course, not gonna be the home of the doctor, but instead it's going to be the hospital address. The communication method, the mobile or email, whatever. So I've just abbreviate all of these in a word that is or NQAC, the name, the qualifications, the address for the doctor, and the communication method to communicate with the doctor once you need. So this is the first thing in the header. Okay, the doctor's data. The other thing, this is a prescription. Just notice here, the doctor's information is here, and these are the patient information. It comes after the doctor's informations. Okay, so this is the doctor data, the name, qualification, the address, and the communication method. So first thing that you gotta write is your name. So I'm gonna write my name, and let's say it's going to be the just Sarah. Okay, this is the doctor name. The qualification, for example, let's say if he's a medical student and he has graduated, okay, and address and mobile, like certain email, okay, this is at, and then .com. If it's an email, then write the patient name. Okay. Then I'm sorry, I got like something in my chest. I don't know what it is. But yeah, sort of influenza, maybe so. The patient data going to be name, age, sex, address, and date of visit. Notice here that some sort of information of the patient is more than that of the doctor, because this is our concern, the patient, not the doctor. We want to know more about the patient, so that's why do we have all of these lists. So the name, the age is going to be whatever, and the age 16, 17, 60, 80. The sex, whether a female or male, the address of the patient, and date of the visit. Okay, so all of these have to be in the prescription. You gotta be aware of. So let's pretend that a patient, it is name, let's say John. Okay, John. And the sex, he's a male, right? And the age, 17 years old. And address going to be email, for example. Date 20 January, or just okay. This is going to be the information of the patient. The name of the patient, the age, the sex, the address, and the date of the visit. Okay, let's move on to the body of the prescription, which is our concern, the most important thing in the whole prescription. So, the first thing that you're gonna write RX, which means take, before each medication, such here, Rex. The other thing, you're gonna write name of the drug, right? For this example, ciprofloxacin, which is an antibiotic. Okay, so this is the name of the drug after the simple RX. Okay, then the name of the strength, dose, or form in the pocket. So here's the strength, the dose, 500 milligram. And then the form, whether it is tablet, capsule, vial, or ampule. So all of these have to be mentioned though. The tablet's form of the drug. So by this arrangement, take the name of the drug, the strength, and the dose. The strength, dose. Then the form of the drug, right? Okay, that makes sense. Make a lot of sense, actually. Okay, what else? Here we have the form. We've mentioned that the quantity, dose, and duration. Okay, so dose means how many tablets that the patient needs to take, whether it is 2, 3, 4, 5, 6, 8, etc. Okay, and the duration, the quantity. So here is this is in Arabic, right? It means that tablet for 12 hours. This is going to be the frequency, right? And for 5 days, the duration, right? Okay, so the frequency, and the duration then. This is the quantity. How many times daily? We've mentioned that in the dose. So the quantity, dose, and duration, we've just mentioned that, and how many times daily, just the same. Abbreviation for frequency and dose are correct. It has to be correct. Write the dose and the frequency in Arabic or any language that the patient understands. Okay, that makes a lot of sense. So the body gonna be the work simple, name of the drug, the strength, the form, the quantity, the how many. Okay, this is just included in the quantity. Okay, just let's recap what we've said. So here's the body of the prescription. Here is the Rx, name of the drug, the strength dose, the form of the drug, then the frequency, and the duration. All these are included on the body of the prescription. Okay, this is the body. We've done it from the body and from the header, which include patient data and doctor's data. Okay, the next thing going to be the footer. Okay, it's going to include the revisit or refill or etc. The doctor's signature. Okay, this is the last thing, by the way, the footer. Okay, just it is the same as the heater, it is opposite to like a heater, body, and footer. Okay, so all of these are the content of the prescription. Okay, the example, okay, just revisit the doctor's signature. This is the doctor's signature, and the revisit or refill if the patient needs that. Okay. Okay, this is an example for the prescription that were given from our professor. Here is an example. The doctor's name, for example, Sarah, qualification, MPPS, and this is the email for contact. And then the patient name, Dawn, the sex is male, age 17, address, and the date of the visit. So this is the header, right? Which includes the patient data and the doctor data. This is the body, right? This is the RX, the name of the drug, the strength, the form. Okay, this is the frequency and duration. And it has to be mentioned that the frequency and duration has to be in the language that the patient understands, whether Arabic, Spanish, Italy, etc. Okay, this is the body. The footer going to be the doctor signature, and if there's some sort of the patient wants refill or revisit, we just put it here and according to what the patient needs, right? Okay, so that all for prescription. The prescription has heater, body, and footer. Okay. That's it. Thank you very much.